Good evening and welcome to Chicago Tonight. I'm Paris Schutz. Brandis Friedman is out on assignment. On the show tonight,
reality stares you right in the face.
Dr. Anthony Fauci warns that hospitals could be overwhelmed by a post-Thanksgiving surge of coronavirus cases as millions travel over the holidays.
In many ways, the data speaks for itself.
And the data is grim. More people are dying this year, and not just from COVID-19. Cyber Monday sales are expected to break records due to the pandemic. That and more business headlines from Cranes.
$36 million in investment towards violence prevention.
And Chicago's next budget will increase funding for violence prevention programs by nearly $25 million over last year. But some advocates say it's still not enough. But first, some of today's top stories. Governor J.B. Pritzker says a batch of Pfizer's COVID-19 vaccine arrived at O'Hare over the weekend and is likely being stored in a cold warehouse facility just south of Kenosha. The arrival was first reported over the weekend by NBC5. Pritzker says it's unclear how much of the vaccine came in this shipment and whether or not it's likely to be distributed in Chicago. He says it's being stored while Pfizer and other companies await an emergency use authorization from the FDA, which could come in the next 10 days.
It's my understanding that the delivery will start to take place a few days later, not the next day, although a lot of people talking about 24 hours. But the reality is it'll take several days, and I just heard that on the White House Coronavirus Task Force call moments before I came here.
And state public health officials report nearly 6,200 new cases of COVID-19 with 85 additional deaths. The total caseload now stands at 726,304 with 12,278 total deaths. The 7-day test positivity rate is 12.2%. Watch where you park. Chicago's overnight winter parking ban starts in the wee hours of tomorrow morning. From December 1st to April 1st, the city bans parking on 107 miles of arterial streets between the hours of 3 and 7 daily. That's in the morning. The ban is a precautionary measure in case the city needs to plow the streets after a snowfall. And don't be caught unaware. Violation of the parking ban will run you $235 and a possible trip to pick up your car at the auto pound. And another warning, stay away from the Lakeshore over the next 12 hours. The city of Chicago has issued a Lakeshore flood advisory until tomorrow morning at 6. This as the National Weather Service predicts dangerously high waves reaching up to between 13 and 17 feet tall due to extremely strong winds. And you just heard the latest Illinois Department of Health statistics that show that nearly 13,000 people in Illinois have died after testing positive for the novel coronavirus. According to the Cook County Medical Examiner, nearly 7,000 Cook County residents have died after contracting COVID-19. And there's another grim reality beyond those statistics. Amanda Vinicki spoke with a pair of researchers who honed in on those figures, and she joins us now. Amanda, what did you find out?
Well, Paris, we are all supposed to stay in place as much as possible, but roll back to March when shutdown orders were first put into effect. Then, as now, the point was to try to prevent transmissions of the coronavirus and to help hospitals from becoming overwhelmed. University of Illinois Urbana-Champaign computer scientist Sheldon Jacobson looked at Centers for Disease Control data of deaths in the U.S. from that time, from March through May.
There were secondary, unexpected consequences of COVID-19 during this time period, and it's showing up in people dying who maybe would not have died otherwise. And this is what the data was revealing to us.
Jacobson, that is, and his co-author compared rates of death from those 3 months this year versus last year, removed any in which someone died after testing positive for COVID, and found what they describe as 30% excess deaths, as in around 30,000 more people died in that span this year, not counting those who had the coronavirus.
So all we have are the numbers, right, in the data. And in many ways, the data speaks for itself, that indeed there's been excess deaths. And the big million-dollar question, of course, is what's causing it.
The data does not answer that question, but co-author Dr. Janet Jokala has some hypotheses.
Could it be that the COVID deaths were underreported during this time period? I think that's entirely possible. Because if you remember back to this early time period earlier this year, COVID testing was not widely available, and there were deaths and infections that were going by that weren't recognized, and they weren't known to be COVID.
A second theory, people avoided going to the doctor.
They weren't going in for their regular checkups or cancer screening procedures like colonoscopies and other things. It's very possible that there were other medical conditions, whether it's cancer related, heart disease related, those kinds of things that were just unfortunately neglected, if you will, during those times, and people were reluctant to go in.
Or maybe it's related to an increase in opioid use. Perhaps it's a combination. Again, the data from the research doesn't say. This does, however, comport with findings from the CDC, but this research also looks at deaths by gender and age and found that these excess non-COVID deaths were most apparent in men ages 15 to 54 and women aged 24 to 44. There is one statistically significant exception, and that is girls ages 5 to 14.
There were fewer deaths this year relative to the past. And one thought with that is that because the stay-at-home orders and the shelter-in-place orders were in place during that time, perhaps the young girls were not as exposed or at risk for accidents as they might have been other years, because accidents are the most common cause of death in that age group for young girls.
Given what we know about the disproportionate impact of COVID-19 on people of color, I asked Jacobson whether he looked into and took into account factors like race. He says the data on that is too sparse, which speaks to a larger issue. Jacobson says there is a paucity of reliable national data.
If there was a national standard that had been set, then we would not be in this situation at all. It would be much clearer, we'd have much more valuable information, and it'd be much more consistent message. But there was a breakdown at the federal level, and this is one of them. People talk about a lot of the issues at the federal level in terms of the response, but in reality, the lack of a data strategy has been one of the great obstacles and headwinds for us getting a handle on COVID-19.
He's hopeful that that will change. The president-elect's plan to combat the coronavirus includes a promise for more comprehensive data.
And we'll be able to hopefully use this information so that if we have to deal with another pandemic in the foreseeable future, we will then be better prepared for it. At this point, in many ways, we're kind of walking in fog, and we're trying to get some insights with the limited information that's being reported.
Jacobson and Jokelay project that all told, the U.S. could see 350,000 excess non-COVID-19 deaths this year. And Dr. Jokelay says it's important to try to nail down the causes of that so the unmet medical needs can be addressed. Paris, back to you.
Thanks, Amanda. Thanksgiving saw the most air travelers since the coronavirus pandemic began, despite repeated warnings from public health officials about the dangers of spreading the virus. Hospitalizations for COVID-19 have also hit an all-time high, with more than 93,000 Americans currently hospitalized battling the disease. And now health officials fear a post-Thanksgiving surge of cases could leave hospitals short of beds and staff. Here's what Governor J.B. Pritzker had to say this afternoon.
If we are not especially careful right now, the surge will overwhelm our state's healthcare system.
And joining us now with more is Dr. Emily Landon, a specialist in infectious diseases and executive medical director for infection prevention and control at U of Chicago Medicine. Landon has been providing advice to Governor Pritzker on his response to this coronavirus pandemic. Dr. Landon, good to see you again. So you heard Governor Pritzker there. Given what you saw with Thanksgiving travel, will the healthcare system in Illinois be maxed out pretty soon?
I don't know. There are a lot of things. I think of it as a tug of war. You've got the mitigations, and people really, Illinoisans are smart and Chicagoans are smart. They realize that more people are getting COVID and hospitals are getting full. They hear from their friends and neighbors. And so that's keeping people from doing too many contacts and really cutting back on contacts. And then on the other hand, you had a really important holiday that was really pulling people to be with families. And while some people didn't maybe cut back their Thanksgiving or didn't travel as far or as much as they would have, they still may have had gatherings with more people than lived inside their household. And so it's really hard to know which is going to win, and we're going to find out sometime soon.
And that positivity rate's come down a little bit. It looks like it's stabilized, but if there is a post-Thanksgiving bump or surge on top of a surge, as Dr. Fauci has said, when would we see that materialize?
So we'll start seeing the cases probably in a week or two. But what's really important to know is that what's done is done with respect to Thanksgiving gatherings. However, if you were in a Thanksgiving gathering, the most important thing you can do now is make sure that if you do get sick, you don't spread it to anyone else. So please keep your contacts to as low as possible. If you felt like you needed to be as part of a Thanksgiving gathering for whatever reason that was really important to you, now's the time to make sure that if something bad did happen at that gathering, that you don't spread it forward. That could keep us to just a bump after Thanksgiving instead of another exponential spread surge on top of a surge.
Yeah, and in fact, Dr. Birx has advocated just get a test if you were anywhere on Thanksgiving and quarantine. What's the situation at U Chicago Medicine? And we're all concerned about ICU capacity, hospital capacity. What are you seeing at U Chicago?
We should be concerned. At University of Chicago Medicine, we are about stable. So we are really lucky. We were seeing things going exponentially up and up, doubling all the time, over and over again, very quickly. And then over the last 5 to 7 days, things have plateaued and leveled off. I really like to see that plateau go back down again. But I think actually we're going to see at least a bump, if not another surge on top of a surge because of the Thanksgiving. Nonetheless, anything we could do to slow the spread, whatever it was, mitigations probably helped, but also good common sense really makes a difference here. So I think whatever that is that was holding us steady for a little bit, I'm really grateful for it. We all are.
And amid this, as you know, Chicago Public Schools announced it will be going back for in-person learning starting in January. Let's hear about what Dr. Fauci said about in-person learning for schools this weekend.
Close the bars and keep the schools open is what we really say. The default position should be to try as best as possible within reason to keep the children in school or to get them back to school.
So what he's saying is the evidence does not point to schools as being super spreader locations. Do you agree with that? Open the schools, close the bars.
I agree with Dr. Fauci. Now, I don't know. I think bars and restaurants, because you have to have masks off when you're there in order to partake or participate in those activities, are really high risk. We should do what we can to support those individuals, but having them open is allowing for too many close contacts, and it's really a zero-sum game here. Schools are a lot less about really close contacts. They are controlled environments where they can be made safe, and we've seen that time and time again. Now, that's not to say that we should cram a bunch of kids into small classrooms and not require masks and not do any of the things that we need to do to mitigate. We need to take a lot of efforts to layer interventions on top of one another in order to make sure that we are providing the safety that we need to protect teachers and kids in classrooms. But there is a way to make it safe, and I think that many schools are able to do it.
And Dr. Landon, all this comes as vaccines are on the way. In fact, it was reported this weekend that a shipment of the Pfizer vaccine landed at O'Hare to be stored just south of Kenosha. Governor Pritzker saying that the FDA could have an emergency use authorization in the next 10 days. Is that what you anticipate? And then when will those vaccines start to come to Chicago?
Well, we are prepared at the University of Chicago to start giving vaccines almost immediately after we receive our first shipment. We are in place and ready to go just as soon we are able to take shipment of the vaccine anytime that they're ready to give it to us. And we are ready to mobilize and start vaccinating individuals as quickly as we can after the EUA comes through.
All right, Dr. Landon, thanks as always for joining us.
Thank you.
And up next, COVID drives record Cyber Monday sales and more business headlines with Cranes. We're 2 days into the new decade and 2 days into recreational marijuana being legal in Illinois.
All our residents will be subject to a stay-at-home order.
The other pandemic that we're far too familiar with in America.
The best is yet to come.
It ain't over till every vote is counted.
This is far from over.
It's going to take years to really understand 2020. Cyber Monday shoppers are expected to blow away sales records today, and Chicago eyes 4 new sites for redevelopment on the south and west sides. Here with more on both of these stories is Crane Chicago business reporter Danny Eckert. Danny, good to see you as always. Cyber Monday, especially important this year because of the pandemic. How big is this for retailers today?
Well, today was expected to be the biggest day for online shopping ever. Adobe Analytics predicted that there'd be more than $12.5 billion spent buying things online today. That'd be 35% more than last year. And that's what happens when you have a public health crisis, keeping people away from physical stores. On Black Friday, traffic at physical stores was down 50% year over year, and online shopping was up. And it's certainly good good sign for the economy that you have people spending money. But there's a challenge certainly for mom and pop retailers that may not have the robust shipping expertise that some of the big ones do. And then even for the big retailers, just filling the volume of orders and getting them all sent over. And, they have new features like picking up in parking lots that haven't been tested at this scale.
Let's quickly hit on this other story. Invest Southwest, $750 million public funding for projects, private development projects. Remind us what this program is and what the candidates are here to get some of the funding.
Right. So Invest Southwest is Mayor Lightfoot's highest profile effort thus far to boost investment in some areas of the city on the south and west sides that historically haven't seen it. The idea is to steer $750 million of public resources into 10 blighted commercial corridors on the south and west sides. And they're taking bids from developers on what they'd like to do with these different projects. They started with 3 of them in August, and they got about a dozen responses, and today was the second wave. There were sites that are mostly city-owned land in North Lawndale, in Bronzeville, in New City, and in South Chicago. The city's envisioning a mix of apartments and retail for some of these sites. And the idea with Invest Southwest is to get a lot of the different city departments on the same page so that when one of these projects gets done, the city is there to help with the ripple effect, getting things like improved streetscapes.
All right, and we saw some of those projects. We'll see what comes of them. All right, Danny Eckert, thank you so much.
Thanks, Paris.
And up next, Chicago boosts funding for violence prevention programs, but first we take a look at the weather. Chicago's violence prevention programs got a boost in funding this year. The city's 2021 budget that was passed just last week includes $36 million for violence prevention programs. That's nearly $25 million more than in 2020's budget. But Chicago is on track to finish the year with between 700 and 800 homicides, and some advocates say that additional funding is still not enough. Tonight, as part of WTTW's first-hand initiative exploring gun violence in Chicago, we once again look at violence in the city as well as efforts to curb it and heal communities. And joining us to talk about funding for violence prevention programs are Vaughn Bryant, Executive Director of Metropolitan Peace Initiatives in Chicago and Communities Partnering for Peace; Chris Patterson, Senior Director of Programs and Policy at the Institute for Nonviolence in Chicago; and Eddie Bocanegra, Senior Director of Heartland Alliance's Ready Chicago program. Gentlemen, welcome all of you to Chicago tonight. First, with you, Eddie, we all know that violence has increased drastically this year. Shootings, homicides up by about 50%. Eddie, remind us how violence prevention programs tackles this issue.
So, for the most part, the way that we folks in this call and some of our allies tackle this issue is through a number of series. We recognize that there's a lot of prevention work that most organizations are doing, and there's more highly concentrated focus that we're doing, specifically those who are at the highest risk of gun involvement, those who are more likely to be a victim or a perpetrator of gun violence. And the folks that are in this call here, what we do is, first and foremost, build relationships, build rapport with the men and women in these communities. And we do it in multiple ways. We hire people from the community, we train, develop them, and then we try to saturate specific communities where there's highly concentrated violence, and we try to engage them, asking them to step away from something, but at the same time, asking them to step into something, whether it's employment, whether it's CBT, whether it's housing, and the folks in this call are collaboratively working on this issue to address a systemic problem that most of the time government falls pretty short on.
So Chris Patterson, as Eddie just said, you're trying to reach out to some of the folks that could be vulnerable to violent crime. Explain the day-to-day life of an outreach worker and how you reach these residents.
To Eddie's point, building relationships, going to those hotspot areas, and those hotspot areas are determined by the number of shootings that happen in any given neighborhood. So the communities that Community Partnering for Peace, Ready Chicago, and our partners at Chicago Cred cover are those areas that unfortunately mothers have had to bury their children, and we've filled hospital beds because people have been shot. Developing those relationships with sometimes people who in many ways don't have relationships outside of the groups that they hang out with on a day-to-day basis, offering them something new. Like everyone has this idea of betterment in themselves, right? And so the outreach professional, their work task on a day-to-day basis is helping to assess, identify, and help those participants get to where they want to be in life, whether that's accessing, jobs, employment opportunities, going back to school, mental health support, substance abuse.
And sometimes it can be as simple as just having young people have someone that believes in them and helps them. Vaughn, make the link for me. More investment in these kinds of initiatives. Shootings. Do shootings come down the more you invest in these programs?
We'd like to think so. I think part of the point is that, in addition to building those relationships, that we help put people on a path to a dignified life. Like you can, potentially intervene on a particular conflict, but if they're not sort of engaging in some activity that's going to move them away from their current status, then they're going to end up back in a conflict on their block again. And so, part of what we want to do is do more of what we're doing, both in the communities and across the most vulnerable neighborhoods. But we also want to coordinate across the lifespan. So part of that investment went to, increased funding at the Department of Family Support Services, which is building a similar infrastructure for peace, working mostly on the youth end. So if we can start to intervene and heal some of the adults who ultimately are raising the kids, and the kids all have the right resources as well, then, from a, sort of a healing the community perspective, that's where our work is mostly done.
So it's working with adults and young people. And Eddie, as we mentioned at the top, there's a significant boost in funding this year from the budget. So what specifically will that fund now that perhaps in previous years you weren't able to fund?
Well, first of all, let me just say that it's great that we are, one step forward in the right direction. $35 million compared to what we had last year is a significant amount. But at the end of the day, what is $35 million when, as Chris pointed out, we're close to reaching out 800 individuals being shot, this year alone. And if you think about the cost for every person, it's about $1.4 million every single time somebody gets killed in our city of Chicago. That is taxpayers' dollars that are paid. Last year, we spent over $200 million in police overtime, in court settlements. And so we talk about over $200 million. In the scheme of things, $35 million is not enough. And we've heard, Arnie Duncan from Emerson Collective talk about some of these communities focusing about $10 million per community, focusing on the top 15 communities in our city to help reduce the violence, thinking about economic development. It was pointed out just a moment ago about education services. We need more, and we need the city to step up. It's great that philanthropy has been doing a bulk of the heavy lifting here, but we do need the city, we do need the government to step in to support these initiatives.
And there were some aldermen that had proposed $50 million for these programs before they all agreed on $36 million. Now, Chris Patterson, what's the ideal amount here for these programs to reach their full potential?
I think I want to think about it in a couple different ways. So I do think, 50 million and up. We had one proposal a couple years ago that was in that ballpark of about 150 million. So what we need to also understand is that while we're doing the direct service that supports those who are at risk of either shooting someone or being shot, it doesn't do, the money that's allocated now doesn't make schools better, for instance, and it doesn't provide employment opportunities, nor does it address direct mental health support that people need, right? And so, what I fear is that we kind of get lost in this idea that if we just throw money at a problem without fixing the structural reason why the problem exists in the first place, we'll find ourselves here often.
There's a lot of different prongs here, obviously. And Vaughn, Chris mentioned the mental health component. You know, there is this part of the budget for a pilot program this year of mental health first responders. How important will that be, and just tackling mental health in general?
I think it's extremely important. I think if we can provide mental health versus, putting handcuffs on people and locking them up, that's a step in the right direction. And, hopefully we're going to learn a lot about what it means to send mental health professionals to violent scenes, and that, hopefully the calls that are taken are vetted in a way where we know what the appropriate resource will be for those individuals, and that they get the necessary support they need to, again, move their lives along in a dignified way.
Right. A lot of that program is connecting people to the right resources. All right. I want to thank our guests, Vaughn Bryant, Chris Patterson, and Eddie Bocanegra. Thank you so much.
Thank you.
And that is our show for this Monday night, abbreviated to give you special Prudge programming. And join us tomorrow night at 7. Author and former Tribune writer Evan Osnos on his new book about Joe Biden, and an online exhibit showcasing the stories of women living with HIV. And before we go, a reminder that at 8 o'clock tonight, we have our monthly virtual community conversation. Tonight, we take a look at the impact of the election on the Latino community. Visit WTTW.com/events to register. And now for all of us here at Chicago Tonight, I'm Paris Schutz. Thank you so much for watching. Stay healthy and safe, and we'll see you right back here tomorrow.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a Chicago personal injury and wrongful death firm that is proud of their attorneys selected for the 2020 Illinois Super Lawyers List.